Anyway, so basically going to talk about research progression and defense, okay? So basically, this all your muscles is a bit like a wall lah. So your aim is to get to the end and get past this muscle surgery, but it's memang not easy with a lot of hurdles along the way. And one of these hurdles is research, okay? Uh, can all you hear me? Normally, the best is that if you can't hear, then you say no, okay?
We can hear you. It's a little soft though. I don't know if there's a way to make it louder.
Mm, there's a way to talk louder lah, I suppose. Okay, can you hear me better now?
Yes.
Yeah, okay, so let's go on. Okay, so all of you, okay, some of you may be female, but that's a male. So all of you are busy now, okay? You all have your work, you have your work rounds, you have your OT. Some have to go and help in OT after office hours as well. So basically, master surgery is not easy. I can personally say that as well. But as you can see, somewhere along the shelf at the top there is a research book, okay? And unfortunately, quite often this is put to one side because you're trying to focus on your logbook, you want to get better, you want to become the surgeon that can cut everything. Okay, so basically sometimes research is put, but the thing is that if you don't get through your research, you're not going to sit the final exam. Okay, you won't be able to sit your part 2 exam. But as I said, it's often neglected and quite often procrastination kicks in as far as research is concerned. Okay. So, but this is what you want. Okay. Some of your seniors, they're so happy, they pass your thesis and they go into the exam and pass. Okay. So this is the goal that you all are looking for. Okay. But of course, the any war, you need to know, well, I don't really call that enemies, they're your lecturers and assessors, examiners. Okay. But you also need to know yourself also, i.e. your own research. Okay. So these are some of the research group. Okay. Prof. Gauri is in the group here, but these are also importantly quite often your examiners in the final thing. Bar my picture, I tend not to be in the final one. Okay. But yeah, quite often these people are here are in your final examiners. So good to know what they tend to ask, what is their focus on, okay? Because you need to know what they are. They don't generally try to kill people. Okay, but most often is you kill yourself on. Okay. Okay, so what does it go through? I think all of you know, particularly those of you already in third year, that you have a appraisal every twice a year. Okay, first year, second year, third year, you all have, and then fourth year, of course, you have your thesis defense. Okay, so just a recap for in case some are first year. So basically, sometimes, and then some of the second, third year may test, it come a bit like a shooting range, is it? Huh, Gauri? But basically, you have 3 lecturer consultant and they look through your thesis and then they'll see what can be done. Okay. But basically, you should take it in a good manner lah. That's what normally try to say. Buang yang keluar ambil jenis. Okay. But basically, the outcome, it can be rejected. You can get a major revision, minor revision, accepted. And sometimes if you get a major revision, that's when you go to the research clinics, okay, where they'll actually bring back after the assessment to try to see what can be rectified. Okay, so all these are to help you lah. Okay, it's not to shoot you down within the picture, but it's to help you. Okay. Okay, and finally, when you reach your fourth year, this is a thesis defense. So this is actual thesis defense, okay, of one of our candidate this year. So you can see presentation in the huge clinical auditorium, which is unfortunately usually quite empty. And so you get to present your thing within 7 minutes, and then they'll mark you according to this thing, okay? So if you have major revision, that means more to unacceptable, unsatisfactory criteria, then you have to redefend. Okay, and worst case scenario, thankfully don't see often, it can actually fail and have to be extended for 6 months. So we don't want to see that. Okay. So what's the key? First thing is that you need to know your research well. Okay, so quite often we see people come for the progress and really sometimes even for the thesis defense where they don't really know their own research well. Okay, it's more like sometimes my supervisor asked me to do this, so I do like that. Okay, so what's the rationale? What's the research question? Why are you doing these studies? Why is it relevant? No, don't just say it's because first in Malaysia that unfortunately doesn't always work. Okay, so you must have a bit a deeper rationale than that, something that can bring some advantage to society, whatnot. Okay. And the other thing that quite often that people get stuck is it's quite simple. Is the objective. Okay, so you must have one primary objective, so you don't have like multiple primary objective. So you only have one single primary objective, and after that, your secondary will can be how many more you want. Okay, why we only need one primary objective? Because that primary objective is the thing that is going to use to calculate your sample size. Okay, so you must be very clear what is your primary objective. Okay, and sample size, I think you've had a lecture before on this, so I'm not going to dwell on it, but it's a quite often a stumbling block for a lot of the masters in the progression and the thesis defense as well. Usually thesis defense not so lah, because I think that's a bit too late to do anything about sample size. But this is something very important, and we'll talk, and this is why it's very important later. I also recommend to get a statistician early so that you sort this thing out. Of course, you can use online software like G-Power or whatnot, but sometimes you just need that a bit of help from the statistician just to make sure that you're on the correct path. I think that is a worthwhile investment, because sometimes you have to pay for the statistician. Okay, and of course, know why you do certain statistical tests. Why is it some is IQR? Why some is it some of it is confidence interval, normality, all that you have to know in and out lah, because it's your study. So if you use it, then you need to know well. Okay, there are some of the examiners who can ask in quite detail about statistical tests. Okay. And then of course, if you're in the update, you got any provisional results you want to share, but this is not compulsory. Okay. So I just show that you're up to date and thinking about what to do next. Okay. And of course, simple thing, even for a normal presentation, we always try to keep the time. And the other thing I have to say is that you are not alone in this thing, you are under a supervisor, if not supervisors. Okay. And try to discuss the supervisor, not the night before, which is unfortunately quite a common thing actually. So if possible, they are actually allowed to come along to your proposal, and definitely for thesis defense, they should really come along. Okay, because not that they can answer the question for you, but sometimes the moral support and a bit of tambah here, tambah there can be helpful to you, particularly in the final defense. Okay. So the other thing is that you need to know how you present. So this particular for the first years, I think second year, third year should be better already. But this is a bit of an outline of how you should do. Because you'll be surprised, but quite a few people actually get stuck even at the title. Okay, so title should briefly tell what you're doing, and then what is you're actually looking for lah. If necessary, certain times you also write the center and the time range. Okay. That introduction. Okay. By the way, these slides are thanks to Prof. Gabriela. I got it from her. Okay. So what is the problem question? What's already known about the problem? Because quite often it's not something completely new that we're studying on. And this is why I mentioned the rationale lah. What do you think is unknown or can be improved? And how you want to do this? Okay. So literature review. Normally we don't dwell on this too long, but you give a short list of literature that is relevant, and in particular the one that you're going to use for your sample size calculation. Okay, and then research question. What is the problem you want to investigate? So remember, this is a simple question. So sometimes we gonna in the proposal. So the question may must start with the W's and the H. Why, what, why, who, how, no? So it should be a question, okay? Not a statement. Okay. Then as mentioned, this research primary, what is your primary objective and what are your secondary objectives? Okay. Hypothesis, I'm not going to go into here because I think gone through it before in the previous lecture. You always have a null and your alternate hypothesis, whether it's your superiority study or non-inferiority study, you still should have a null and alternative hypothesis. Okay. Then your methodology, important, particularly if you have gone through ethics, what's your ethics, whether it has been cleared or not, and what instruments you're using, what procedures you're doing, and certain case you need to also talk whether you have some the budget necessary or not. Okay. But again, not too long because you only have 7 minutes. And what's the inclusion? And what the exclusion criteria of your study? So what you have said inclusion, you don't have to repeat exclusion. For example, you say, I know patient have to be, more than 50 years old, inclusion, then you don't say exclusion, patient less than 50, not necessary lah. Okay. Yeah, mention sample size calculation, very important. Okay. And then you have to follow with the consort diagram. Okay. So showing, how you randomize analysis or not. And don't forget your Gantt chart. Okay, so this is rough idea of how long you're going to take to reach certain milestones in your study. So it's good to pace yourself. Also good to show your examiner whether you're keeping up the pace or not. Okay. Results, if you have demographic dummy tables, just an example of what a table should look like. Lah. So not some people, I think Prof. Garvey they will copy and paste straight from SPSS, so they have a lot of other things. So try to do the table yourself. Don't just copy and paste from SPSS, because sometimes you got a lot of unnecessary things there. Okay, and then of course discussion and conclusion. We state the problem, summarize the conclusion, and then see, of course, talk about your limitations and your superiority of your study, and whether you were able to accept or reject the hypothesis, and final recommendation. But of course, this is more for your thesis defense, not so much for the proposal stage, unless you're well in advance. So I mean, this quote is saying that the beginning is the most important part of the work. And I think as far as your master's thesis is very important, because I think some will attach, some of the seniors will attach. It's a bit mafan when, every single assessment you're changing your topic, okay? Because that happens to some of the candidates. And then one of my candidate, he may attest also after the second year or so, is still not changing topic. So I myself am responsible. So try to make sure right at the beginning, you get a research topic that is, one, worth doing. Two, is bring some question so that so that you don't get in the thing that in the proposal, what's the point of doing the thesis? People have done it before. So it has to be something worth doing and must make sure that it's doable. Okay. Of course, all of us dream of doing this huge randomized control trial multi-center, but not always doable, particularly because of cost and whether you can reach the numbers necessary. So it's good to think big, but not too big. Okay. And particularly if you're thinking about big trials, consider multi-center ethics application, so that if you say you're starting your thesis in your KKM center, then you can continue to do it in UMC without a gap waiting for ethics again. Okay, so try to, so that you have a continuity of your data collection. And as I said, always try to keep to the Gantt chart. Okay, so a rough timeline of what you should be doing now. I said I'm not focusing more on the research part. I'm not talking about when you should start doing mastec or colectomy. Okay, so by first year, of course, most of you are focusing on your exam, but it's good to actually start looking at what you want to do, writing out the research proposal, and if possible, to submit the ethics. And the other thing is that for you to be a primary investigator, you more or less need this good clinical practice certification, which I think is worth doing because you only need to do it once in your life. It's not that expensive, and you offer it every few times a year. So it's worth doing because it solves a lot of headache later when you're applying for ethics or not. Okay. And second year, you start, of course, will be data collection already. Hopefully not, doing new topics or not. And third year, hopefully everything goes well. You have completed your data collection and start data analysis and thesis write up. Okay. Always the thing that stick in my head is one of your associate prof. In the third year, when the fourth year students are asked to finish up the thesis, this prof in the third year is saying, can I pass up mine? Okay. So it's no harm for you to do it early and get it out of the way early if possible, so that you can focus on your logbook and other things. Okay, so no harm. So try to do it as fast as possible, of course, as correctly as possible. And if you can start doing your analysis and write up in the third year, all in good. Okay, not a must that you must first year, because by fourth year you're supposed to have finished. You shouldn't be doing data collection anymore, hopefully at fourth year. And by then, you need to start looking at your Turnitin report lah, since everybody likes to use AI at the moment. Okay, but talking about the actual defense, okay, there are certain senior consultants worth presenting to. Last time it used to be like more or less compulsory that everyone had to present to Prof. April beforehand, but I think now she's quite busy. But you can try other, particularly your own consultants within the so they say like for URG, present to Prof. Ong, Prof. Shanga, okay, because they are they are the seniors who may be one of your examiners as well. Also senior consultants who are not quite good at research, Prof. Shereen, Prof. Iravan, Prof. Aisha. These are other people that you can just I say that, can I have 7 minutes, 10 minutes of your time? Just want to present my thesis and see whether my thesis defense and see what you say. Okay, other thing, make sure simple things, but quite forgotten, make sure you're well rested. Don't be on call, please. And then make sure you're well dressed and try to keep your presentations professional. Okay. Try to avoid animation, jokes like that. Okay. Keep it professional and just get it out of the way. Okay. There will be times that they try to shake you, but most of the time, from what I see, they're not really trying to do that. They just want to make sure that you know your thesis well, you know what you're doing, and that you can defend yourself well. But of course, if criticism is due. I mean, you should know your limitations of your study, so don't try to fight back. Certain things you say, yes, no, I accept this criticism of my study. Maybe we can correct that in future study. It's fine. Okay. So don't always say I'm right, I must win. Not say like that. Okay. Sometimes you have to lose certain battle to win the war one. Okay. So and then other thing, whichever religion, pray. And cannot emphasize practice, practice. So you can present to your own colleagues. Make sure you keep to time. Make sure that you articulate the correct points well. Practice what are the potential questions that can be asked. Simple things, sample size lah. What do you bring to the society lah? These are very common questions that they're gonna ask during your defense. So yeah. So as I said, finally, all the best. Okay. So as I said, research is as Gauri put, no, I'm not exactly the best person, but as I said, it is something worth because a lot of us, even KKM also, we have some of our urologists like I don't know people William Ong. He's one of the urologists in Alustar last time for Penang, but even though he's KKM, he's like publishing massively, okay, and networking or not. So it's not you are able to do all these things even if you're in KKM, and it can be quite worthwhile okay, because he becomes quite well known when he goes for all this international conference or so people know William Ong from Flexor Group, okay, so it's worth it particularly if you want to aim for those things. And of course, anybody wants to join university, most welcome, okay, because we're very short. Okay, thank you.
Thank you, Dr. Ahmad. Probably I'll open the floor first with if anyone wants to clarify anything in regards to your own progress. Maybe we can try giving some advice. Yeah. Any questions for Dr. Ahmad?
Yep. And Ida, okay or not?
Oh, okay.
I mean, for your thesis, thesis or no problem.
In progress.
Okay lah. Try to finish it kau lah. You're going to final year already kan?
Yeah, December.
Yeah lah. So more or less final year already lah. So yeah, get it out of the way cepat lah. Seriously, you can't really focus on all your group study until you finish your thesis. That's from personal experience.
Okay.
And then, yeah, go ahead. So, okay, I give a hypothetical question. Say some of them are not in according to like the Gantt chart right now, where we propose that third year they should be wrapping up. What do you advise they should be doing to pass in the process so that they, by the time it's pre-defense, that they are ready?
That one is depend on what is the status of the thing now. I mean, certain thing there have been some candidates that where they found. I mean, ideally you should actually decide at the beginning whether your study is feasible or not. Okay, because if you take something that's non-feasible and you find that you cannot get the sample size, you can't get the patients, or you cannot get the budget, then it becomes difficult. So in those cases, sometimes particularly in the third year, sometimes no choice, have to discuss with your supervisor and fall back on some retrospective study that just to do the research so that you can sit for your exam. It's not ideal, and memang the examiners know it when they see it, because they can see, how come suddenly change topic and then become something like that. But as I said, it's not so nice lah. Okay, but I mean, you get the thing done, but you at the same time you feel like could you have done better in your original research. So of course the thing is that you have to talk to your supervisor regularly lah. Unfortunately, most of us are a bit busy, so you just really have to catch us and drag us somewhere and talk to us or something. Okay, because we are also partly responsible if you guys stumble as well. Okay, so it's not all your fault; it's our fault as well. So I said discuss with supervisor. If there's something that can be done, like maybe instead if you can't get the full numbers, if it's something new, maybe just do a pilot study, do pegawai head setup. And then but sometimes you have to find other ways of doing it. Or then suddenly have to collaborate with another center so that you get more data, something like that. But third year is a bit dicey lah. You should be looking at those kind of problems more in your second year lah.
Actually, there is nothing wrong in doing a pilot study, but then if it's already been done, it's very hard to call it's a pilot
Yeah.
study. If you're repeating a study which is done in a different country, the only ability to do a pilot study is that there is that particular outcome has not been compared yet worldwide.
Yeah, of
Then you
course.
can propose a
Yeah.
pilot
And
study.
you can't say everything pilot lah, only if it's not been done before.
Then in terms of sample size, normally it's more of how you justify your sample size and the reasoning behind sample size. You can even have RCTs where there is only 25 people per arm, but you need to have the right justification and the reference paper. So I think maybe you will be prof soon. So
No, but they had the lecture on sample size before, they can.
yeah, it's done. So,
Yeah.
but what I suggest is that they should bring and with the right, sit down, as what you said, go to a research consult and sit down and check that the way they explain their sample size is correct. Because you
Yeah.
cannot just come and say, I'm collecting 100 patients, because you have to say why, what reference to use, which outcome, the primary outcome, you're using the primary outcome. And so that's how you're calculating the sample size. The justification ends up being confusing. And so a lot of the assessors end up questioning it again and again, but actually it's not the numbers they're questioning, it's how you're explaining the numbers.
Yes. Most often, generally, you find a paper that is closest to your research. Of course, it shouldn't be exactly the same, otherwise you shouldn't be doing it in the first place. But something that is most similar to research, find what's the what? The impact of that study, the effect value, sorry, of that study.
Yeah, the effect value.
And then use that to calculate your sample size. That's basically sample size calculation. So if you don't have any study at all, that's where the pilot thing comes in.
Yeah, correct.
Yeah.
So as far as project wise, they allow all projects. It's just that you show some reasoning behind your project. It's how you
Yeah.
present it and reason with your
The
findings and
introduction and
reason.
the research question is important.
Yeah. Can be simple projects. I don't believe they want you to do anything complicated. So that's why Dr. Ahmad is saying that don't do something bigger than what you are able to manage. Especially for the ones who have started, obviously the ones who already have project. The only way out now is to finish your data collection and finish your analysis and write up. Yeah. And if there's any issues which you are facing, try and see a supervisor within this week. Don't wait any longer. You should be seeing them within the week. If you really feel that you're struggling with data collection or you're confused with how to justify the findings you see, you should be speaking with them as immediate as possible. The minute you're already confused, you should be seeing them. Yeah. Any other questions for Dr. Ahmad? No?
I think that if you have some research methodology, you're not sure, you can always, run through AI. They can list down quite nicely as well, what to do. But of course, that's more of a guide, cannot follow 100%.
Yeah, you can't copy
idea
paste
you
that, but
can
you can
just-
see what it suggests and
Yeah.
then get a bit better understanding. Yeah.
I need to run for another meeting.
Yeah, sure. No problem.
Thanks
Anyway,
for everyone's attention. And
Yeah.
on the best side, anything you can always contact me. I think most of you, at least I see quite a few here that should have my phone number. Okay.
Thank
Okay.
you so much. Thanks.
Bye.
Thank you, everyone. So we will end here. Do you have any questions for me before we end it? No? Everything. Okay, so next week, it's the one to do with authorship, publishing. Prof. Shankar's doing the talk, right? Nadia? Is next week's one Prof. Shankar's talk?
No, it will be Turnitin.
Turn it in, then Prof.
Yeah.
Shankar's after that,
And
is it?
then Dr. Sharifah.
Okay, all right, so not yet. So anyway, next week's one, turn it in. I suggest everyone who's in third and fourth year, please come and make sure you listen to how you actually upload your report and so forth, because trying to struggle to know how to do it last minute is an unnecessary stress. Yeah. Okay. Thank you.